Welcome everybody. We will be focusing on the CSF rhinorrhea. First point, the most common cause for CSF rhinorrhea is trauma. Second point, the most common site for trauma is the fracture of cribriform plate. Third point, clinical feature, the patient of the CSF rhinorrhea presents with the clear watery discharge coming out through the anterior nasal layers. Fourth point, teapot sign, also known as the reservoir sign. Patient presents with clear watery discharge on bending forward, increase in strain or cuffing. It is similar to the teapot. When we bend the teapot anteriorly, then all the contents in the teapot comes out through the nozzle easily. Okay. Similarly happens with the patient of the CSF rhinorrhea. When the patient of CSF rhinorrhea bends anteriorly, the CSF comes out through the anterior nasal layers. Okay. That's why the name is given teapot sign, also known as the reservoir sign. Fifth point, differentiation. So how will you differentiate between the patient of CSF rhinorrhea and the nasal discharge? So there are basic 6 different points that differentiates between the nasal discharge and the CSF rhinorrhea. The first one is the most basic, is consistency. The nasal discharge consistency is mucoid, while the CSF rhinorrhea is thin watery. Okay, CSF rhinorrhea is thin watery, whereas nasal discharge is mucoid. Second point, the patient of CSF rhinorrhea will always have the history of head trauma, while the patient of nasal discharge will always have a history of any allergy. Okay. Third point, handkerchief stiffening. When we put the nasal discharge on the handkerchief causes the stiffening of the handkerchief. Whereas when we put the CSF on the handkerchief, it does not cause the stiffening because the CSF rhinorrhea is watery discharge. So handkerchief stiffening test is positive for nasal discharge while negative for the CSF rhinorrhea. Fourth point is detection of glucose. In CSF rhinorrhea, there is a discharge of CSF and CSF has the presence of glucose. So glucose is present in the CSF rhinorrhea. We can detect the glucose in the case of CSF rhinorrhea, while we cannot detect the glucose in the case of nasal discharge. Fifth point, the beta-2 transferrin is present in CSF rhinorrhea, while it is absent in nasal discharge. Sixth point, sniffing. We can sniff the nasal discharge, while we cannot sniff the CSF rhinorrhea. Okay. These are the 6 basic points that helps us to differentiate between the CSF rhinorrhea and nasal discharge. Now, paradoxical CSF rhinorrhea. We all know in CSF rhinorrhea there is a fracture of the cribriform plate. Now, in paradoxical CSF rhinorrhea there is no fracture of cribriform plate, but still the CSF comes out. So this CSF comes out due to the fracture of the petrous part of temporal bone. This fracture causes the CSF otorrhea. The CSF otorrhea via the eustachian tube enters the nasopharynx, and through this nasopharynx it comes out through the anterior nasal layers. So here there is no cribriform plate fracture, but still the CSF is coming out. So that's why the name is given the paradoxical CSF rhinorrhea. Just keep in mind, in paradoxical CSF rhinorrhea there is a fracture of petrous part of temporal bone, while there is no fracture of cribriform plate. Okay. Investigations. What will we do the investigations in the case of CSF rhinorrhea? We will go for the high resolution CT scan. Okay. Treatment. First point, as the CSF rhinorrhea is caused due to the fracture, so we will wait for 7 days to heal this to heal the cribriform plate. So by healing, the CSF rhinorrhea can get treated on its own. But till then we give antihistaminics, laxatives, acetazolamines and antibiotics. Why we give antihistaminics? To prevent the coughing. Okay. We give laxatives to prevent straining while stool passing. We give acetazolamide to decrease the CSF production. We give antibiotics to prevent the infection. Okay. Even after the 7 days, there is no healing of cribriform plate and still the CSF rhinorrhea persists, then we go for lumbar drainage. And the third point, even after the 2 weeks, there is a persistence of the CSF rhinorrhea, then we go for the FES. FES is functional endoscopic sinus surgery. Now some additional points. If the CSF rhinorrhea, in the CSF rhinorrhea, if the CSF comes out along with the blood, so we cannot differentiate between the CSF rhinorrhea and the nasal discharge due to the presence of blood, because due to the blood we cannot perform handkerchief test, we cannot perform sniff test, also we cannot perform glucose test. Okay, because due to the presence of blood in the CSF it gives false positive test. Okay, so what we do, we take the CSF that stained with blood and put it on the blotting paper, and when we put it on the blotting paper, then it causes the halo sign or target sign. So the presence of the target sign or a halo sign on the blotting paper indicates that it is the case of the CSF rhinorrhea. Okay. Next point, in CSF rhinorrhea we generally avoid nasal packing to prevent the meningitis. Okay, because in CSF rhinorrhea there is a risk of meningitis. But if there is a nasal bleeding, then we have to perform the nasal packing. So nasal packing is the related contraindication in CSF rhinorrhea. Third point, spontaneous CSF rhinorrhea. In spontaneous CSF rhinorrhea, there is no history of trauma. Still there is a CSF coming out through the anterior nasal layers. So the main cause in the spontaneous CSF rhinorrhea is brain tumor or increased intracranial tension. Okay. These are the additional points. If you like this video, please like, share and subscribe. Made study easy. Thank you.